Good afternoon, ladies and gentlemen. On behalf of the European Union Agency for Cybersecurity, it is my pleasure to welcome our keynote speaker, our esteemed panelists, and all of you joining us through the ENISA YouTube channel broadcast. Today's session is the third and final session of this year's eHealth Security Conference, organized jointly by the EU Agency for Cybersecurity and the Danish Health Data Authority. Out of respect to public health and to ongoing traveling restrictions, this year's conference is being organized as a series of virtual events. My name is Thanos Droukas. I'm a network and information security expert at ENISA, and I will be moderating today's discussion. Our discussion today will focus on the topic of incident response across the EU healthcare sector over these past few months. Our panelists will bring their own unique perspectives and have a discussion on the roles of the public and private sector in supporting healthcare organizations to respond to cybersecurity incidents. Moreover, we're going to discuss how the overall information sharing over these past few months has helped improve the preparedness of the healthcare sector moving forward. Before we proceed with our keynote speaker, I would just like to point out a few housekeeping rules. While this is a virtual event, we encourage your active participation. So all of you joining us through the YouTube broadcast may use the comment functionality to submit any questions that you may want to pose to our keynote speaker or to our panelists, and we will do our best to accommodate. I would like to point out that the comment section on the YouTube broadcast is being moderated, so any inappropriate comment will be deleted. Before we begin with the discussion, I would like to ask the Executive Director of the EU Agency for Cybersecurity, Mr. Johan Lepassar, to give the opening keynote to today's event.
Thank you, Thanos. Thank you very much for tuning in. I want to thank also Go organizers and my co-panelists for taking the time and investing into this very important subject area. Of course, healthcare sector has played a key role in this response to the pandemic, and it's also been the target of major attacks. So talking about cybersecurity in health is something that is particularly important. But we don't want to talk. We only talk, but we also want to see actions, and we want to see measures which would increase the resilience of the sector, not only today, but also in the future. What we see from the cybersecurity point of view is that what we've experienced during the past 8 months worldwide is not something that is going to easily dissipate after hopefully measures will be put in place in order to make sure that the public health situation becomes better. These cybersecurity aspects in eHealth will remain here, and we need to tackle them firsthand. So when we look at the pandemic, of course, one thing that the pandemic taught us is that the key of strong response lies in good cooperation. And good cooperation within the sector, but also good cooperation between the private entities and public entities that deal with cybersecurity in health. And I'm very happy to see that during the pandemic, there were a lot of not only public sector, but private sector actors who reached out and tried to help the health sector at large in order to tackle these new challenges head on. And I want to thank them for doing it. And some of these actors are here today as well to speak about from their experience. At the EU Agency for Cybersecurity, we of course were very, very concerned regarding whether all the actors have the same common situational awareness. We did have cyber incidents and cyber attacks which were targeted towards the health sector or actors in the health sector. We had responses, adequate responses from member states, but also from the actors themselves. But we also should be able to have lessons learned. And one of the lessons learned from us is that although we put together quite rapidly a network where information can be shared. We also counted obstacles for sharing this information and making sure that everybody has the same assessment regarding what the situation is. So of course, in the future, we will be looking at ways how we can essentially address these gaps that emerged and make the information sharing, but the information and knowledge development also much more smoother. So I would like to call everybody who participates in this discussion today regarding the resilience of health sector in Europe to look into the future and also to draw recommendations and let's say conclusions or preliminary conclusions from the lessons learned thus far. As I noted, coordinated incident response is something that is still at the very beginning at the European level. So I think we can all learn from the lessons, and we can all make sure that we build a future which is more resilient and more apt at addressing any kinds of concerns that might occur in the future. So with these words, I would like to thank the organizers for giving me this opportunity to say a few words as an introduction. I'd like to welcome all participants and wish you a very fruitful and useful discussions during today.
Thank you very much, Johan. Indeed, the healthcare sector has been at the forefront in this battle against the pandemic, playing a key role. And obviously, as healthcare organizations have been by default pushed to their limit, combating cybersecurity incidents becomes an even harder task. And obviously, safeguarding the availability and integrity of healthcare services, particularly in these times, is something that requires contributions from everyone and coordinated contributions at that. Before we begin with our discussion, I would like to ask our panel members to briefly introduce themselves and their organizations, and particularly the role of their organizations in supporting healthcare providers over these past few months. And I would like to start by giving the floor to Mr. Søren Greenfield from our co-organizers in this year's conference, the Danish Health Data Authority. Søren?
Thank you, Danish. Yeah, well, as you already mentioned, my name is Søren Greenfield, and I'm a head of department of cyber information security. My department is, as you said, a part of the Danish Health Data Authority, where we collect a lot of data from the different parts of the healthcare sector. In Denmark, the healthcare sector is one of the 6 critical sectors from the NIS directive. And in our sector, we along with the operators of the essential services, we created or developed a sector-specific cybersecurity strategy, which outlines some of these topics and how we actually respond to it. And I'll come into that a little bit. My department has the responsibility to coordinate different cyber information security initiatives in the strategy, and also how to implement and do it operational for the sector. In this session, we are focused on the incident response. So I can tell you a little bit about how we do that in Denmark. We collaborate with the different healthcare sectors across the world and share threats and collaborate on intelligence. We do this both in formal and also informal networks, where the key is collaboration and sharing of knowledge. Inside the Danish healthcare sector, we collaborate on the incident through a MISP, a malware information sharing platform, where the different operators of this of the service or in the sector has access to this platform and share knowledge. The platform has a technical view, so it's not it's for technical people. We can share technical indications of compromise and work together to solve the different threats we face. So actually, there's a collaboration platform where some of our operators, they see something and then we work together on solving it. Further, we collaborate with other critical sectors. We also do this in another MISP, and we have a MISP with critical sectors and the different national authorities and share knowledge about the threats and incidents there. The next step for us is taking the leap towards a more operational level, where we want to tie the different security operations centers into different operators of essential services into a analysis center, or a search, you could say. So that's the next level, to add this more operational level to our collaboration. Yes, I think that was my words.
Thank you very much, Soren. We also have another national competent authority responsible for cybersecurity in the healthcare sector today with us, represented by Ms. Sheila Becker. So, Sheila.
Good afternoon, and thanks for having me here today with you. So I'm working for the ILR, which is the competent authority for the health sector, but also for energy, transport, drinking water, and digital infrastructures. And we are also the single point of contact for Luxembourg in the NIS cooperation group. Before I joined the competent authority, I worked in cyber defense at the Luxembourg Armed Forces and at the Ministry of Defense. So I think that's what's to say about me. Thank you.
Thank you very much, Sheila. Our next panelist is a member of the ZCERT in the Netherlands, Mr. Frank Ritsema.
Hi, good afternoon. Yes, my name is Frank Ritsema. I work at ZCERT, which is the Dutch sectoral healthcare computer emergency response team. I work there as a senior security analyst, and we mostly provide our constituents with help on incidents on the cybersecurity domain, and also provide information that hopefully helps them to prevent incidents. So we can help them deal with questions they have to increase their resilience and their maturity level. And we also try to bring them together to help each other deal with those questions. ZCERT is quite young, so to say. We've been around since 2017, and we're still working hard to expand our constituency to cover the whole healthcare sector within the Netherlands.
Thank you very much, Frank. And last but not least, our good colleague from CERT-EU, Mr. Georgios Psychakos.
Hello, good afternoon. On behalf of CERT-EU, I would like to thank you for the invitation to join this very, very interesting topic. I am Georgios Psychakos. I'm the strategy officer and partially member of the incident response team of CERT-EU, which is the computer emergency response team for the EU institutions, bodies, and agencies. Our primary role is information hub and incident coordination center for our constituents, and of course the close cooperation within the other EU entities, cybersecurity stakeholders, which were utilized in these special times. Let's put it that way. Thank you.
Okay, thank you all for this introduction. Now, in order to set the stage, so to speak, for our subsequent discussion, I think it makes sense to go very briefly into investigating exactly what happened over these past few months in the healthcare sector. So what were some of the actual incidents in practice? Was there actually an increase? What are some of the trends that were identified? And Yorgos, since you were the last panelist to introduce yourself, I would give the floor back to you to tell us from your perspective, what is it that you saw over these past few months?
It is a very interesting question. I would like to say, when you say, okay, what happened? Well, we are not sure yet what's going on. We have to say that the COVID-19 health crisis is not a cyber crisis, but gave the ground for the cyber criminals and other state actors to launch hostile activities against not only the EU institutions or the member states, but also to the citizens. We have identified that this uncertainty that we have nowadays within our society the expansion of teleworking circumstances and the new state of the world, let's put it that way, increased the attack surface. So what we have observed the first month, and I might say was in March, the phishing and spam attempts were more than duplicated compared to February. Although they didn't have significant success, and then we observed a decrease, but it's still there in numbers. What we see is that the attackers demonstrated an adaptability. They adapted their techniques, and they have tailored their attack attempts to the more specific working circumstances. So we do not have too many incidents, but we see that we have advanced techniques in place. We see also that it's not only the health sector that is targeted. Other sectors have been targeted to help the attackers to tunnel their actual attempts. What do I mean by that? Give me an example. If you attack a university that has strong relations with a hospital, it can be a very nice target, and to have the initial intrusion and then tunnel your efforts to the hospital. What we have seen now in the EU institutions is that the teleworking happened rapidly. The constituents didn't have enough time to respond to this request of teleworking, and many security trade-offs have to take place. What we see at the end of the day is that we still lack basic cyber hygiene. So we do not have a very specific cyber weapon out there that's sophisticated like the COVID in the health sector. We see the traditional conventional attack techniques, but because of the lack of the cyber hygiene, these were successful. Thank you.
Thank you very much, Giorgo. Frank, same question to you. Working with that primarily deals with the healthcare sector, I'm sure that you can also provide some quite useful insights.
Yeah, let me try. I think overall, what George has just described is the same thing we've seen as well. Early on during the pandemic, there was a big increase in phishing related to the COVID-19, kind of leveraging it and playing into the fears of people that, of everyone really. It wasn't necessarily targeted towards the healthcare sector, but it was tied to it. We saw campaigns leveraging specific supply of aids like face masks and things like that, trying to trick people to into phishing. Another thing we noticed with the big increase of people working from home is that there was a lot more activity scanning for systems that allow remote access into the companies. Of course, before the pandemic, we had some. There have been some quite big vulnerabilities in different products related to working from home. So in that sense, it was quite an interesting year to have the start of the year, having everyone coming into the office because working from home wasn't possible anymore. And right now, switching back to everyone working from home. With the same challenges that the most organizations were not built for having everyone working remotely, and it required a lot of effort from the hospitals and the other healthcare organizations to provide in that. As Georgios also mentioned, that required security trade-offs both on remote work, remote access, but also on collaboration tooling to be able to work together and have your meetings. And especially in a hospital, that's very challenging. Luckily, we haven't seen big incidents related to that, but we, as I mentioned, we did see a lot of increase in scanning traffic and the phishing part.
Thank you very much, Frank. Soren, from your perspective as a national competent authority, is this similar to what you viewed over the past few months?
Well, actually, over the past 2 months or 3 months, we saw a dip over the summer in the phishing attempts, and actually, and now they are beginning again going for the vaccines, but it's a little more focused. So they actually do a more advanced approaches, not just normal phishing. They try and target a specific vaccine production or vaccine. People working on vaccines and trying to figure out what they do and steal their data. So they're a little more specific now. Yeah, that was a quick answer.
Okay, thank you very much. So now that we have a fairly good understanding of what has been happening in practice over these past few months, perhaps it's time to examine it from, let's say, the healthcare provider perspective. So I would imagine that especially in times like these, health organizations already pushed to their limits might not be in an ideal position to deal with, let's say, any sort of increase in cybersecurity attacks. So Sheila, I would like to ask you, from your perspective, what do you perceive to be some of the key challenges that healthcare organizations faced over these past few months when it comes to incident response?
So I think especially now with the second wave of COVID-19 infections, there's a huge challenge in human resources. So I see not necessarily only concerning incident response, but overall in the healthcare sector, they have to be focused on different things maybe, and they have to be integrated in maybe patient care, and so they are not able to focus on their day-to-day job, which they would be doing in a normal situation. So I think that's one of the main challenges, and I also think that's not only for the healthcare sector the case, but overall, but especially in the healthcare sector, it's the most challenge, I think.
Thank you very much. Soren, same question. What do you view as some of the main challenges for healthcare providers during this time?
Well, if you take the view of the cybersecurity, as Giorgio says, it's actually the same as always. Cyber hygiene, having patching done, and making sure your systems are well protected, and that might not be the main focus right now on many of the organizations. So that battle between getting new apps to work and whatever systems are being put into place in a hurry, they have to see the security as well, and maybe even patch old systems at the same time. So it is just a challenge to get all those things working at the same time. So the push for quick implementation and fast responses to different shifting attentions from both political but also from the pandemic makes security even harder to do, because you have to maybe even shortcut some of it, and you may not get it all done, while still having to protect the real open and
Thank you very much, Soren. Frank, same question to you.
Yeah, I think what Sheila said is a valid point, with human resources be also on the IT security departments of the organizations being a difficult task to manage. Things changed for them. The attack vectors shifted. So there's a lot of getting used to that, and it requires effort to deal with that and to properly get those under control. I think that would have been one of the main challenges early on during the pandemic. Right now, with the second wave, I think most organizations were better prepared due to the first wave and what they learned there, and so I think that was helpful. So I think it's a bit more under control right now.
Thank you very much. And your same question.
Well, I agree with all the speakers, and I would like just to note that in this is a crisis that affects and concerns the human factor. The human factor is under stress, not only the medical personnel, but also the supporting personnel of these operations. And it is something that we take, we spend significant time to see what we are going also to do in the cybersecurity sector, because being on alert for 8 months to support the ongoing operations is not going to lead into good results at the end of the day. Another thing that I would like to note is that we need to demonstrate rapid understanding on the lesson learned. We do not have the luxury of time now. So attacks that we observe in some member states or in other sectors, now we need to take the corrective actions much faster than in real normal operations.
Thank you very much, Giorgo. So it seems that the already stressed out thin healthcare sector has a number of challenges to face, even though the sector appears to be a little better prepared this time around during the second wave of the pandemic to deal with cybersecurity incidents. Now, obviously, supporting the healthcare sector will require contributions from the public sector, from the private sector, from other stakeholders across the ecosystem. So I would like to hear, and this is a question to all the panel members, because you represent organizations with different perspectives and roles in this process. We would like to understand a bit what were some of the successful collaboration models to support health organizations over these past months, and especially how was information effectively shared across the healthcare sector? How did you ensure that key stakeholders had appropriate situational awareness? And how did you go about building this sort of collaboration? So I would like to start this question with Frank.
Yes, thank you. That's actually a couple of questions in one. I think the collaboration part is very important, has been very important, and still is on dealing with this crisis. And that's let's say that's twofold. One is on the technical perspective, sharing observables of incidents, actionable data, stuff like that, and also the collaboration on dealing with the problems that arise. I mean, most of the healthcare organizations within the sector deal with the same problems. So for us, it's been important to get them together to deal with those problems together and not have everyone do the same thing on their own. As we said before as well, they're already stretched thin, so it's important to learn from each other and share your experiences. I think, at least in the Netherlands, that goes fairly well, at least. But it's also something that we keep improving on and keep trying to find better and new ways to make sure it happens in the most efficient way possible. On the second part, on the sharing of technical data, so IOCs and observables, we in the Netherlands actually, due to the pandemic, sped up the process of creating a network that allows sharing of those events through our constituency. We call it the Healthcare Detection Network. As Søren in his introduction also pointed out, they use MISP. We use the same system to make sure that we can share all the observables with their constituents and also have them share back with us and the other healthcare providers so that they can share what they see. So it might help prevent incidents at other organizations. And we think that's a very good and efficient way to make the whole sector more resilient. Yeah, I think that's about it.
Søren, same question. I recall from your opening statement that you mentioned working with stakeholders quite a lot. As Frank also just mentioned, you developed a MISP to share technical information. So could you please walk us through a bit on your specific activities in that regard?
Sure, and I might add another point as well. But for our malware information sharing platform, we actually had that in place before the pandemic, because we saw early on a use for a collaboration platform, as Frank also mentioned. So when an operator of an essential service sees an incident or an observable or an indication of compromise, they go into this platform and add it to the technical list and see, okay, this is what we see. We see this command and control server from the outside trying to attack us. And then the other members of the sector can go in and add, say, okay, I also see this attacking my operator or my place. And then together they actually form a much better picture of what they actually face. So they actually collaborate. They might not even need us to do it. They do it themselves. So we, of course, extract information and put in our own information, but it is a collaboration platform that works in itself. So we use that a lot. I can add another perspective is that we actually used a lot of collaboration with the different sectors. So we had a lot of with our telecommunications sector in the beginning, where we had these phishing attacks, along with our national competent authority on the telecommunication. We blocked a lot of sites. So we saw phishing emails. We might even have gotten them from a patient or person, a civilian person in Denmark, and we got information out of this, and then we blocked the domain for everybody in Denmark. And we had this an add to the law that made us do that very quickly. So within a 24-hour period, we could actually block the site. So we actually used a lot of our time collaborating with a different sector and our own, because then we made sure that they didn't have to think about it in our own sector. We blocked it for them.
Thank you very much, Søren. I would say same question, Sheila.
Thank you. So as a competent authority, we don't have an operational role in incident response. But what I learned in Luxembourg, and not only in the healthcare sectors, in Luxembourg especially, and I don't know about other countries, but as we are a small country, it really counts in knowing people, getting in touch with the people, exchanging on not necessarily only cyber incidents, but also just getting to know each other, getting up common terminology. And ways are very short. So what we do as a competent authority with all the sectors, we make workshops with different sectors one by one, and so that they get to know each other and we get to know each other with the sector. And there we can exchange ideas. And the focus of these workshops is more on a preparation side or preparedness side, because we work on a common baseline for a risk assessment of the different sectors. But so what is main important is really to know each other, so that you actually just have to call someone and get to, hey, I saw this, do you have the same issue? And also getting people to use more, like Søren said, the malware information sharing platform. I think that's the most important issue, that you really don't hesitate in sharing information. Sometimes you hesitate because you don't want to look out from the outside as vulnerable or something. But if you get to know each other, you will not hesitate that much anymore. So it's really just already, if you know each other, you are one step ahead, and that's important in all the sectors, especially in these kind of situations. But overall, it's a very important step to take.
Thank you very much, Sheila. Finally, Georgios, I think that CERT-EU played an important role in activities related to information sharing during this time. So perhaps you can share a few good practices and walk us through the process.
Well, CERT-EU is member of the CSERT network, as it was established by the NIS directive. And what happened actually in this, or what is happening actually in this COVID time, is the network operates as it has exercised before and as it has demonstrated in cyber exercises in the past. What does this mean practically? That immediately had the MISP operational, and we exchanged indicators of compromise between the CERT-EU and member states, national cybersecurity authorities, even this the NCSAs or CERTs, it doesn't matter. And then the member states were receiving these IOCs and were disseminating to the proper competent authorities within their constituency. The same happened also at EU level. But I would like to bring something new over here. Maybe it's not well known that taking the opportunity of the COVID, ENISA proposed to formulate a task force with the relevant European cybersecurity stakeholders, namely the CERT-EU, ENISA, and EC3 as primary stakeholders, and we established an unofficial network of information exchange to maintain situational awareness at union level, as it is feasible, of course. The positive thing is that this worked very well. It had very positive outcomes because what we were doing, the famous ENISA report for situational awareness, was disseminated to the member states and were very well received. Therefore, we are working currently to make it more official, more formal. And there are several initiatives on the policy sector to establish such a thing in a permanent basis. I would like to say that compared to other circumstances, in the COVID case, at least the EU institutions shared and contributed equally and productively to formulate the situational awareness at Union.
Thank you very much, Georgios. We already have a few initial questions submitted by our audience via the YouTube channel broadcast. At this point, I would like to remind all of you who are watching this discussion and are interested in contributing, you may use the comments functionality on the YouTube channel to submit any questions that you may have for the panel members. So one of these questions relates to a topic that was partly discussed previously, and it's about technical information on incidents such as IOCs, and whether it would make sense to facilitate, let's say, better sharing of this information, not only within the operators in any one EU member state, but even across organizations across member states. So I don't know if anyone would like to offer some views on this topic.
Yeah, I can say something about it. I think it's a good idea, and I also think it already happens a lot, especially through the NCSCs of the different countries, which usually are the main point of contacts for the country. In the Netherlands, the healthcare section is not served by the NCSC because in the Netherlands, the healthcare sector, at the moment at least, is not a vital sector. So usually, if we're talking about healthcare, which is my area, we do work together with the NCCNL, and they do provide us with the intel that comes out of other member states as well, when so required. Besides that, we also work together with other healthcare sets across Europe and also outside of Europe, but that's more in an unofficial capacity to share anything relevant, mostly about trends that we see, incidents that happen within the sector, to see if we can, if we see the same things and to get a better situational awareness of what's going on.
Thank you very much, Frank. One other very interesting question that was submitted by the audience has to do with, let's say, it's less on the information sharing side and more on the preparedness side. So the question is, should cyber drills coordinated by cyber authorities become mandatory for certain sectors, such as the healthcare sector, which is one of the sectors of essential services? It would be interesting to point out here that the EU Agency for Cybersecurity organizes a large-scale biannual exercise called Cyber Europe. At every instance, this exercise has a very specific sector focus, and actually the upcoming Cyber Europe exercise will focus on the healthcare sector. So this is actually a question that's very close to our own heart as well. So I don't know if one of you might want to comment on this.
I would like to comment. So I think that cyber exercises, as any other exercise, are very important, especially with my background in cyber defense. So I think it's really important getting all the actors together and exercising some different scenarios from time to time. About regularity, I don't know if it's good to do it twice a year, or maybe just like once a year would be enough, or every 2 years like ENISA does with the Cyber Europe exercise. But what I don't necessarily see is making it mandatory for the sectors. I think one should be more working in a collaborative approach, setting incentives for people to participate and for sectors to participate in an exercise. Because actually, if they participate and if they have a good exchange way with the competent authority or the cyber authority in lead of the exercise, then they might get back information like about vulnerabilities or best practices. So getting more communication flow with the actors, and I think that's one of the incentives that could really work instead of making everything mandatory, because having it in legislation is sometimes hard to implement in practice. So I prefer being in a collaborative approach and working on the goodwill and good effort of people. Thank you.
Thank you very much, Sheila. So on the topic of cyber preparedness, actually, we have another question from the audience who cites a fairly recent incident that had massive implications in patient safety as a result of a cyber attack in a hospital in Germany. And the question has to do with the urgency. So in your opinion, and based on the, let's say, experience of these past few months, are healthcare providers in a position, and do they have the technical means necessary to respond to such incidents with the required urgency?
I can say something about that. I think if you ask about, in my experience, well, it's hard to say. Yes, I think so. And also, we in the Netherlands have the advantage of being a fairly small country with a lot of hospitals. So it's fairly easy to, when it is required to reroute to another hospital in case of emergency. It is a hard question though, because you never know what the attack is going to be. So how do you know if you're going to be prepared for it? It's always a little bit of a cat and mouse game. Overall, and especially if you look at threats like ransomware, I think all the recent incidents. We had a big one at the university earlier a little bit earlier, and they provide case studies that the hospitals can learn from and know what to implement to prevent those types of attacks. So I think the maturity level on that is getting higher by the day. Yeah.
Thank you very much, Frank. Solon, do you have any insights on this as well?
Yeah, there's two main points: is prepared and quickly enough. That's, as Frank says, it's a cat and mouse game because they adapt all the time. Are they quick enough to react? That also depends on what it is, the kind of attack. I would say that we are pretty prepared, but it can always be better. And one of the areas, that's also why we work on it, is working together. That is the main area where I can actually could, with some ease, elevate all of us to share what we see instead of just seeing in our own silos and having the knowledge. I think that's one of the key areas. That's also why it's the main topic here. The sharing is what they do on the dark web. Everybody, not everybody, but they share in these different forums on how they attack, or they can ask each other on how to do it. But we don't really work that much together in the different sectors and across the sectors. So yeah, I would say we are prepared, but we're prepared for everything. No, we're not prepared for everything. But one of the main routes are sharing, both with our own sectors and also with other sectors, and certainly with other member states. So, yeah.
So my understanding from your response is that you believe that there is room for improvement when it comes to information sharing. So perhaps the experience of these past few months has given us concrete examples about what can actually be improved specifically when it comes to information sharing. So I would like to ask actually this question to all of you from your point of view. When it comes to information sharing about cybersecurity incidents, what do you think we can do better, at what level, and perhaps who should take the lead in certain aspects? So I don't know who would like to start. If I can pick myself, I would say perhaps Georgios, you can say a few words.
Yes, I will attempt to, and at least I will provide some background for the rest of you to, So, information sharing. Okay, everybody says it, very few do it, and even fewer do it right. What is information after all? In my experience in the CERT community, which is more than 10 years, is that, okay, IOCs is good, okay, we want them, but what we lack is the context of these IOCs. And when we say context about an event that has been observed, monitored, and analyzed, it is the context which is sensitive. We might reveal who was targeted, what was the impact of the attack, and while we think of it, we consume time that we do not have. And then we end up in a labyrinth of sharing this information that it's not always done in a secure manner. And at the same time, the attackers also, oops, they're on us. And maybe we should retract our evidence from there. So that's the real problem. We do have information sharing, at least in the CSER network, we do share information. We have established the necessary trust to do so. But when we are talking about cross-sector information sharing, or even now that we are discussing at the union level information sharing, then it becomes a very, very complicated issue.
Thanks a lot, Georgios. So perhaps, Soren, you would like to also say a few words about this?
I can usually say something, yeah. Actually, an area where some of our information sharing is working very well is with the end users or the patients or the normal person just being on the street, because they see the phishing attacks when they happen. So we actually have an app in Denmark called, it is in Danish, but I can translate to cyber defense, and there the people can actually add their incident to the government, you could say, and then it's distributed to the relevant place. That's some of the areas actually work very well, where we actually engage the citizen in the cyber defense. I think that would be something we could work more on and actually engage the people on the floor, because they'll see it the first time the phishing email comes, and that they can become one of the first lines of defense. That worked very well in the first 3 months.
Thank you very much, Soren. Frank, perhaps you would like to add to this discussion?
Yes, of course. I think what Georgios said is, I agree with that. I also think that there's always a bit of reluctancy to share about incidents that you had, but it would be good if we could try and move away a bit from holding back all that information, because everyone is having incidents. It's not a question if, but more than when. So I don't think there's any shame in admitting that you had an incident, but it can be very useful to share your lessons learned and the data you got from that incident within, at least within the sector, but preferably with anyone that you might be able to help with that, to make sure that those incidents don't repeat themselves, and so that we get more resilient altogether.
Thank you very much, Frank. Sheila, any thoughts on this?
Yeah, sure. So I think what Georgios said is very important, so that you have in a CSIRT network, you have a trust already built up. But within the different sectors or among the sectors, you don't have that already. because you don't know the people yet. So you need, as I said before, you need to get to know all the people. And on this note, maybe it's also interesting to say that actually Belgium, Luxembourg, so the Belgium telecom regulator, the Luxembourg ILR competent authority, as well as a research institute list, Luxembourg, and the Security Made in Alu, who is the developer of the malware information sharing platform. We have a funding got from the EU together for a NIS directive user community. And I think this might help in the future also to get a little bit more trust among the different sectors and within the different sectors to share vulnerabilities or to share in more context on the indicators of compromise, because I think that's really a big issue, like Giorgio said, that you don't want to show people that you might be vulnerable at some point, or where the attack had impact or did it not have impact, things like that. So trust and getting to know each other is, I think, the most important thing that we can work on together.
Thank you very much, Sheila. Actually, we do share this sentiment that building trust at every level is very key in ensuring this sort of information sharing. I would like to move on to a slightly more forward-looking question. So, obviously, this past period has served also as, let's say, a learning platform for all of us with this new situation. So I was wondering, already we touched upon the topic of some of the lessons learned from the perspective of information sharing, but indeed there have been other lessons that we learned, and perhaps some actions have already been decided on how to act on these lessons learned, and either actions have been taken or perhaps there is a roadmap. So I would like to ask all of you to comment on this. So how do you believe that the lessons what were some of the key lessons that we learned, first of all, during this period, and also how would you act on these lessons learned? And I would like to start this question with Soren.
Certainly. Well, as I mentioned, one of the key learnings, or the key learnings from it was that we had to collaborate with different sectors that more than we thought. For example, the defense for the healthcare sector started with the telecommunications sector. So that's one of the learnings we have, that we even more enforce the collaboration across the sectors, because we are not isolated in the healthcare sector. We have to think more holistic approach to it, also in our own initiatives, and we'll monitor those initiatives on the different sectors more closely. And actually, we hope to collaborate more on joint initiatives in the next strategy, and also in the next time we update our own strategy, we will add the other sectors into the work, because it's as you all of you say, we have to share, and we also are dependent on others. Actually, we are more dependent on the telecommunications than our own sector. So some of our risk, when we do the risk assessments, we actually rate the telecommunication sector higher than their problems or their systems higher than our own, because we can do emergency operations are different in the hospitals, but it's very, very hard to do some of the stuff we do when we have no communication. So that's a learning.
So thanks a lot, Soren. Sheila, any thoughts on this?
Yeah, so I think the main lessons learned is hope for the best, but prepare for the worst. But also it's to know that actually just because you are in a crisis situation, that attackers or anybody will take care for you or about you, and that you will not be attacked during this time of crisis. That's one of the, well, it might be astonishing in the beginning, but otherwise, of course, it makes sense for them to make their money out of this kind of situation. But also what is on a good side is, like Johan said in the beginning, that actually in the beginning of the crisis, that there were from the private sectors a lot of companies who tried to give support to the healthcare sector when it comes for cybersecurity. So I think that's also a very motivating sign for the world, let's say. Thank you.
Thanks a lot, Sheila. Frank, from your point of view, as a CERT specializing in the healthcare sector, what were some of the key lessons learned? And obviously, to some extent, you may have also implemented some action points moving forward. So can you please comment on that?
Yes. First of all, to touch upon where Sheila ended, the support from all the organizations to the healthcare sector was very, very good to see, and I guess that's also a bit of a lesson for us to work more closely with the how do you call that? With all the companies within the cybersecurity to come together and provide support for the healthcare sector. There's been quite a lot of initiatives, both international and within the Netherlands. So very happy with that. Let's see. I think mostly also on the collaboration front with we already touched upon it, but within the I think we learned that's more important than ever. I already touched upon it a little bit earlier, but we're going to keep working on that and improving on that, also to make the sharing as efficient as possible. Try and find a way to get the right information to the right people as quick as possible. The last point would be what Soren touched upon. Let me just think back. No, I lost that point for a bit. Maybe I'll come back to it later.
Okay, thank you very much, Frank. Georgios, same question on lessons learned.
Well, we have two types of lesson learned, or at least lesson observed at the moment. The first is on the technical track, is that at least regarding to the CERT-EU's work on the technical implementation of security controls and specialized measures on the teleworking and so on. Yes, these have been noted, and we have already moved forward with extra controls that revealed incidents not COVID related, but because of the measures taken in this occasion, we were able to identify. And I would like to put a closer on the technical measures. I think more important were the lesson observed of enhanced collaboration between the EU institutions and the public sector at the union level. The value of having one single point, such as the joint cybersecurity unit that has been mentioned by the President of the European Commission, now is becoming more obvious. Of course, not an entity that will have a governance structure to mandate on the member states, but most something like that can coordinate and facilitate the information sharing and coordinating the activities that are taking place in the institutions and at the member states and the competent authorities. So I would see the European Commission in the future coordinating this legislative effort of bringing the sectors and the relevant stakeholders even closer. Hopefully this is something that will be also welcomed by the experts.
Thanks a lot, Georgios. Actually, your final remark here brings me to one of the questions submitted by the audience, which has to do with how concretely the European Commission or the national authorities can support health organizations in building up their IT security. And this question also has the component of the potential of, let's say, funding health organizations to improve their cybersecurity posture. So I would ask this question, first of all, to our representatives from the national authority. So Soren, perhaps you have a few thoughts on this?
Yeah. The work we do, both inside ENISA and also the NIS work streams, I see that as one of the main things where we can actually help and improve across the whole board, you could say, if we figure out some maybe best practices, some security requirements that a hospital could actually say that is, and actually push them to their vendors and the different IT organizations, that could be one deliverable that actually will help a lot across the different sector, actually also the sectors, but in our sector it would be very helpful to find a guideline there, because that they can leverage that on inside, so they don't have to do it every one of them. So those kind of initiatives where we actually do something sector-wise on a EU level, that would be helpful. Of course, funding, if that's in any way possible, that also helps. But it's hard to do that concrete and specifically. So the ones we focus on in the NIST stream and in the ENISA workshops would be beneficial.
Thank you very much, Soren. Sheila, any thoughts on this?
Yeah, so I fully agree with what Soren said. And I think that's the overall objective of the NIRS directive in the first place, to get a common high-level security of the infrastructure and the information systems. And I think ENISA is doing a good work in producing best practices for different sectors. And I think that's where to start with, and also the work streams. There's one work stream, especially for the health sector under the NIST Cooperation Group, and Soren mentioned it. So that's where it is started to support the healthcare sector. Of course, it takes some time before it actually shows result and effects, but it is where one can start.
Thank you very much, Sheila. Georgios, same question to you about the potential role of the European Commission and/or national authorities in supporting health organizations. And after that, we have, I think, a question that's just right for you from the audience. So,
can we go to the second question? So, okay. Although I'm not an expert in the funding and coordinating the funds at the European level, okay, I'm a technical staff. I'm pretty sure that the Horizon 2020 is built for that purpose specifically, to enhance the resilience of the member states on the cybersecurity domain. And that's my whole contribution at this point.
Okay, and the second question for you has to do with what kind, because you mentioned quite often before that the whole remote work, everything has actually changed a lot the landscape. So the question is, what kind of additional controls for remote work and related system operations has had to be introduced during this crisis period?
I would like, before going to the additional controls, to first mention that first we need basic cyber hygiene, which means that you should, for example, have provisions to have the necessary resources to perform your tasks, one item. And second is business continuity plans, and so on. So the full spectrum of activities concerning the cyber hygiene. Now, what do we mean with tele-everything? Okay, that we have a much more exposed internet-facing services. Now, practical, what controls can you put there? Depends on the capabilities of the security team. In the EU institutions, for example, and I know many competent authorities in the member states have the capability to monitor traffic, of course, with the consent of the constituency and so on. Therefore, we have the VPN now that is being used more and more. So the extra controls are specific criteria that you can monitor, filter, and raise alerts on the VPN traffic. For example, before COVID, we didn't pay so much attention in the failed attempt logins. Now we see that there is a lot of value behind them. Another thing is that everybody tries to accommodate the management request of, I want my staff to work remotely. And no one puts in that requirement two-factor authentication. Most of the incidents that we have seen during this time, it was lack of cyber hygiene, which means lack of two-factor authentication. You get compromised from home, and then the whole corporate network is down. and it is something that you can easily compensate. It's not technically such a challenge at the end of the day. Another thing is the patching. Okay, yes, we need patching. Now we need prioritization of the assets, and the most critical component needs to be patched in a timely manner. This is also something that we have observed, that the administrators, yes, indeed, they were patching the systems after a month of the release of the patch, and the attackers were already inside. They had a backdoor installed on the network, so the patch, yeah, at the end of the day, not good. And I can keep talking for the next 2 hours, but better not.
Well, perhaps Frank would like to pick up where you left and share his thoughts on what cyber hygiene.
Yeah, I can reiterate how important it is, and how important it is to make sure that all your employees, have the awareness on what to do and be careful on how they do it. And especially with lots of people working from home, it's harder to keep track of all the systems people are using to connect to your network in some cases. And yeah, so help them understand why it's still important, even if they work from home, to do all those things that you've tried to train them to do when they're at the workplace. Yeah, that's about it. I think that's most important.
Soren, any thoughts on this?
Sure. It hasn't really changed the last 10 to 15 years. You have to make sure you have the cyber hygiene, you have patched your systems, you have your, you know what goes in and out of your firewall, all the basic IT hygiene. That's the best defense. And I'll say that, I probably have to say that in the next 20 years as well, but it is the best defense to do. So I call him cyber warrior. That's also, the cyber warriors are also the guy just doing patch management on the endpoints. It's the network specialist who just update that network device a little faster because it feels like it. It's those people who actually do the best defense in anywhere.
Thank you very much, Soren. Sheila, any thoughts that you would like to share on this?
Yeah, besides the patching and more applied technical stuff, what is in my mind really important too is raising the awareness of all the users of the system. So to know that also the secretary knows that they should not click on the link in the email that they don't know the sender, or that they are just aware that they maybe not should share too much information on the internet about the passwords, double authentication, things like that, so that they get more aware, because they make also the security of the system. If somebody gets an email and clicks on the link, but you are patched, maybe it works, maybe it does not work, the ransomware, but at least if you have an awareness user, then they will know that they shouldn't click it. So that's the first step, I think, to do, that all the people having access to a system, and even those who don't have access, should be some level of awareness training in a regular way.
Actually, building on what I understand are common remarks about the importance of awareness raising, what do you think should be the role of the healthcare organizations themselves, and do national authorities have a role to play in building awareness for the medical staff that are, by my understanding, really play a key factor here in these cybersecurity incidents? Anyone who would like to take this question?
Yeah, I would like to. So I think that the healthcare providers should, of course, manage it on their own, because they have to know when they can, or how they can organize themselves to have this regular awareness training. But from a competent authority, I think that they actually could provide information to include in these trainings, or provide even a training, maybe not inside the competent authority, but maybe outside, like we have with the security meeting ALU, they provide regular training, so one could actually collaborate with them together and give the opportunity to the healthcare providers to get these kind of trainings. I think that's a way actually the competent authorities could really help in facilitating these awareness raisings. But of course, they have to organize themselves.
Anyone else who would like to comment on the topic of awareness raising among medical staff?
Yeah, if you look at, do the hospitals need to do it themselves, or should like a company like us, CSIRT, or the government provide in that? I think a bit of both. The hospitals know their own systems, they know the way they work, they know their own processes. They can tailor-make awareness campaigns on that. That's hard to do for a governing entity. But I think if you look at that, the government or CSIRT, we can do it more broadly, also, so not specific for medical personnel, but just in general. And to be fair, I mean, cyber hygiene is cyber hygiene. The basic rules are the same. There might be slight differences, but overall, the same rules apply that some of us already went into. So I think both can help to improve the awareness.
Anyone else would like to comment on this? Because clearly awareness of the medical staff is a key issue here.
I can say 2 words. In Denmark, we do a combination of it. So we try to focus on the healthcare specific, also where people are taught how to be a doctor. We're trying to focus on actually creating awareness already when they are taught in school. And then you have the awareness on the, you could say, more civil level, or on the national level, and we have a competent authority that does that. And then our different operators, they adapt that to their own context, because it has to be very context aware or specific for it to work. So a combination, as Frank says.
Thank you very much, Søren. Now, another topic that's quite relevant here has to do with, let's say, the availability and suitability of a policy and regulatory framework for cybersecurity in the healthcare sector. Now, over the past few years, this has developed and matured to some extent in the EU with the ENISA directive, with policy initiatives such as the medical devices regulation, which also introduces IT security requirements for medical devices, and so on. Based on our experience during this crisis, do you believe that the policy and regulatory framework for healthcare cybersecurity is sufficient? Do you see that perhaps something is currently missing and should be investigated? How do you view, let's say, its overall maturity and fit for purpose for the moment and based on our recent experience? Who would like to go first?
I can, if you want to. So I have a pretty narrow view, of course, as I'm working with the NIS directive in the different sectors. So what I see there, and I think I mentioned it before, is that actually currently in the NIS directive, it is not foreseen to have a bi-directional communication flow. So it's only that the operators provide information about incidents to the competent authority, but actually they don't, or at least it's not foreseen to get any information back, like vulnerabilities or best practices. I think that's from a regulation point of view, this could be done better within the NIS review that's coming up. So I think that's more to get, a collaborative approach, let's say. Thank you.
Thank you very much, Sheila. Anyone else who would like to comment on this? And obviously, this is from your own perspective. It does not need to be policy-specific reply. So anyone else who would like to share their views?
I can share, as I mentioned before, I think what we could use is the, you could say, recommendations on how to do the cyber hygiene in the specific sectors, how to what we should actually ask our IT suppliers as a hospital or as a government body. I think that would be what I would really like to have into the next review. I have also said that in the review. So, but I think that would benefit most of us to actually have something to do on a common ground, saying that this is the level we recommend us being at. I do hesitate of doing it mandatory because that's a whole ballpark on itself to do it and how to review it and do audits on it and so on. But a recommendation would be helpful, and I think we should stick to that for the first part.
Frank, perhaps a comment from your perspective?
Yeah, a short comment. I agree with what's said before. One thing I would like to add to increase focus on with all the devices, medical devices being more connected each day and being managed by outside parties, I think it's important to focus on the supply chain management and include that on provide best practices on how to deal with all the different vendors and their security posture, which directly impact your own security posture. So I think that might be a good subject to focus on.
Okay, thank you very much. One additional question from my side. So obviously these past few months have changed a lot of things in our day-to-day lives. In many cases, these changes will actually be lasting. So my question to all of you is, do you believe, in terms of specifically cybersecurity for the healthcare sector, that our experience over these past few months will leave any, let's say, lasting impact, any changes that will be concretely embedded in how the sector addresses cybersecurity moving forward? So this is an open question to everyone. Let's start with Soren.
Thank you. Well, I mentioned one of the lasting ones. That's the dependency on the different sectors. We really have to do that, think of that more holistic and work with other sectors. So we're not just looking into making our own, you could say, cert, but we're also looking into how to tie it together to the other certs. I know there's a component, a national cert, but we still could improve the technologies or the collaboration between us also on that level. That's some of the lasting ones. And also the last thing is seeing how we could use our, the public. How can we tie into those? People are getting more and more connected, and they have our medical devices at home. They might even begin to use iPhones and iWatch or whatever they're called. That's the next level to see how do we secure that, and while still maintaining the privacy aspects of it. So that's going to be one of the lasting ones. The last one I could say is that some of the different discussions I have with board members or high officials or even just on the doctors level, they know about what crisis management is. They know about cyber could be a potential cyber risk. So there's a lot of awareness that has been created from this pandemic. So on that level, some of the discussions are easier now. That's also a lasting effect, I think.
Thank you very much, Soren. Sheila, perhaps you would like to share some thoughts on this as well?
I don't have much insight on this currently. I'm sorry.
Okay, anyone else who would like to share their views on how the landscape will shape up moving forward?
I can make a short comment about it. Besides that, I agree with Soren. I think the past crisis and also has made the importance of proper cybersecurity really prevalent also on the higher levels within the organization, so on the board levels. And I think that's very important, and I hope that will provide the benefits going into the future with allowing the organizations to grow their maturity level on the cybersecurity front.
Thank you very much, Frank. Georgios, any insights on this?
No, I will agree with the other speakers that it is something that has to be realized in the organizations holistically. It is a problem that will, not a problem, it's a subject that we will keep discussing in the future. And it is the only way to move forward, actually. We have to discuss it and remediate. Thank you.
Thank you. We actually have a couple more questions from the audience, so I will leave this open to anyone who would like to reply. The first has to do with collaboration, and the question is as follows. Everyone is saying that better collaboration is important, so what is stopping that from happening? So perhaps, Sheila, you would like to share some views on this?
Yeah, so I personally believe that it's the human factor. So if you don't know anybody, you are hesitant in sharing information that might be sensitive for your own company or for your own system. So I think that's really the human factor. And I think that's what was said before, that building trust, you actually can prevent this from happening, so that you're actually more willing to share information.
Thank you. Anyone else who would like to share their views on this?
Yeah, I can add. I agree that trust is important. If you say what is stopping from collaboration to improve, I don't think it's not improving at all. I think it is, but there's always room for improvement. So you're never as efficient as you can be. But if you say what are the things that hold you back, then especially in this time, trust is an issue. Building trust requires communication with parties. It's done. It's easier done face to face, which is very hard these days. Yeah, so I mostly agree with what Sheila said, that if there is anything stopping it, then it is that. And also, as I said before, trying to get rid of the shame to admit you had incidents or anything like that holds back working together on those incidents as well.
Thank you very much, Jan. I don't know if Soren or Georgios would like to also share some thoughts on this.
I just had one perspective from hearing what Frank said, and it's taken from the airports, and they have this culture of near misses. And something we could actually work more on is creating a culture where near misses are when you actually divulge a near miss and tell it and learn from it, that we could actually, well, maybe encourage that even more. So instead of just having our NIST corporate, NIST competent authorities get information on something happened, what if we told them to, okay, something nearly happened instead, and having that put into, and then we could use that to teach all of us how did they miss this? What did they do to actually do this? So that's just something I thought about here. So maybe we could take that back to the NIST directive and say maybe we should look at the near misses instead of the hits.
I would like to develop a little bit on what just Soren said. First of all, I will agree with Sheila that trust is the found. Okay, it's something that we need to have at the first place. But actually, what Soren didn't actually clearly say is that we have legislative gaps. So we have different communities in Europe, like the law enforcement, the cybersecurity, cyber defense, and so on. And there is legislation in place that prevents these communities to talk to each other. Instead of having a legislative that will perform as an API for the technical people, take the information and share it to all who is concerned, of course. So I will say that the collaboration, yes, we talk about it. We do not practice it too much because of these legislative gaps. And it's something that we should look in the immediate future. Tackle it.
That's very interesting. So anyone else would like to comment on this specific aspect? Okay, if not, we do have one additional question, quite interesting and also related to something that Frank mentioned earlier. So the question is about the supply chain, and if there is the need to have a minimum set of cybersecurity requirements that healthcare actors, the supply chain, and service partners should fulfill. My understanding is that this is a key topic when discussing cybersecurity in the healthcare sector. So anyone would like to share some thoughts on this?
Well, if you talk about guidelines, yeah, then guidelines are a good idea, definitely. If we can have a uniform guideline for what we expect of suppliers in the chain, then that also helps them to see, like, okay, well, where do I need to work on? I think making those guidelines mandatory, especially within the medical sector, is going to be difficult because some devices are so specific that, yeah, that's always a bit of the choice. But, you know, this device is not compliant with our own security guidelines, but we need it to save lives. So, yeah, what do? You have to make compromises on that. So, and if you didn't just say, like, hey, we're not going to use this device, it's a bit of a struggle. I'm not entirely sure how you would necessarily solve that besides working together with the suppliers to increase the overall security maturity of the whole supply chain.
Thanks a lot, Frank. And perhaps even though I'm wearing the moderator hat today, perhaps I should say a couple of things about this specific topic very, very briefly, so as not to take the time from our actual panelists. There have been indeed two key policy developments that will influence cybersecurity requirements in the supply chain and in service providers. The first is, of course, the medical devices regulation that was mentioned earlier, which introduces mandatory IT security requirements for medical device manufacturers. And the other is, of course, the European Cybersecurity Certification Framework, which will enable the development, the drafting and adoption of cybersecurity certification schemes for any type of CTI product, service, or process. So obviously, this can potentially lead to the, let's say, development of mandatory requirements for service providers and medical device manufacturers on top of any existing, let's say, legal instrument. We do have one additional question that I would address to Sheila in this case. And the question is, should it be mandatory to have a SOC or CERT per healthcare organization?
Thank you. So first, I would like to say that personally, I don't see necessarily the need for having, like, every hospital needing to have one separate CERT or SOC, because I'm a huge fan of binding efforts, because that way you actually can save energy, you can save human resources, in the sense of there are not many cyber experts around, so you want to have those together and work collaborating, because they are way better when working together than if you have only one person providing for your SOC or CERT, because you can't find enough people already to have a 24/7 coverage or things like that. So I think it's a little over the board to have every hospital, and especially having this mandatory aspect of it, because I think hospitals, they know they need to have a CERT, and why not letting them collaborate with each other? Especially like Luxembourg is a small country, we have this approach not only in the healthcare sector, but also like for the government or for other administrations. So we try to bind the efforts and not having different separate groups working on the same stuff all the time, but really focusing and binding the efforts and human resources especially.
Frank, I think that you're also very well positioned to give us your insight on this specific question.
I agree with what Sheila said. I also think a healthcare organization that's a very broad thing to say. I mean, it's not just hospitals. I mean, you have healthcare organizations that are very small, and it's just not feasible for them to have their own SOC or CERT. I think it's more efficient to well, collaborate. We go back to collaboration and try to use each other's resources. So if you do have a big hospital that has a cert, try and work together within the region. Try and work together nationally. And also within the different subsectors to arrange for those needs. But saying mandatory per healthcare organization, I don't think that's feasible to do.
Thank you very much for this. We also have a two-part question related to cyber threat intelligence, which I would like to address to Soren. So the first part of this question is has to do with striking a balance between the needs of the community, for instance, the healthcare sector, for cyber threat intelligence, and the interests of, let's say, security companies who are actually selling this intelligence. And the second part of the question is whether or not there are currently cyber threat intelligence interfaces for exchange with the global community, because so far the discussion has more or less focused on an EU scope. So the question has to do more with, let's say, how this can interface, in fact, with the global community. So, Soren, any thoughts on this?
Yes, I have a couple. The cyber threat intel that we need and distribute are more context-oriented, as George said. The ones we get from, say, when we work together with the Norwegian healthcare sector or the Australian or wherever we are working with, they are context specific. So we know that these are relevant for our organization specifically, where we get the other threat feeds, which are more as security operations. They are more commercial, so that there's a more broad spectrum. So our threat intel are more specific and healthcare specific. That's also why we actually add something when we tie them together and give it to our different operators. So I think there are two different things. You have to have both of them. So that's not a balance. That's an add. But you need both of them. You can't just have one or the other. That's my perspective on it. And then the interface to the global community. The MISP platform, which me and Frank has been talking about, and also others, it is you can connect that to the global framework. There's a global community on the MISPs where you can actually both add and put just share or just add information to your own MISP from a huge range of different MISPs. So if you actually tie your own MISP into that, you will share to the community at large.
Thank you very much, Soren. We have one more question that I think you're also very well positioned to answer. It has to do with business continuity. So business continuity is not necessarily specified in the guidelines on what hospitals need to do to mitigate the risk from third parties. So the question is if you have any suggestions on this topic.
Well, actually, we do one study a year where we see what are the major risks for any healthcare sector and healthcare operators, and we have three major risks. One is malware, and the other is ransomware, is a kind of malware, and then the last one is user flaws. You could say if somebody does something unexpected, and how to actually do something about those three things. It's the same thing you could do. You can have your business continuity plans. You can test them. You can have your cybersecurity vault where you have your backups on an offline version. So it's very, very good to mitigate a lot of different threats and risks we face. So that's one of the main we actually recommend our our operators to do, is to make sure they have the business continuity plans and how to reestablish their business from scratch. So that's the way to. We know there are different risks, but if you can actually do something that mitigate some of them, that's what we recommend. So that's high on our recommendation.
Thank you very much. Another question that we have brings us back to the topic of user awareness. The question is as follows. User negligence is one of the factors that affects cybersecurity, as we already discussed. So the question is about concrete methods and tools that you can indicate to raise cybersecurity awareness, particularly among the medical staff. So, Georgios, I would start with you.
Well, thank you for this question. Actually, a practical guide it is to have a tailored training program. This program can have 3 stages. The first is a general training on the new technologies and the risk that they entail. Like to all staff of a hospital, for example, this is an email, and these are the common characteristics of a malicious email. The second level of training is to conduct exercises inside the organization that the security officer and only the senior management will be aware of, and drive conclusions for that, so that you can improve your existing training program. And the third level that we have recently started using it also in the institutions is with the form of gaming. So you have puzzles or other like sort of adventure games, but they have cybersecurity elements inside, so you can make it more pleasant for the training audience, because that's very important. The training audience should not feel okay, it's another task that I have to complete, but also to see the actual benefits from that.
This is quite interesting. So, Sheila, any suggestions from your side on this?
Yeah, so I fully support what George just said. So putting it in a game manner is a very effective way in getting people interested, and also they're joining it, really like making it true and not just ignoring things. So actually in Luxembourg, we have the Security Midinalu, and I'm not paid by them, although I mentioned them a couple of times. But they actually have a room 42, where they set up a game basically with a cyber incidents, but it's for non-technical people. So you might have directors, you might have secretaries who join there, and they are put under stress and see how they react to some cyber issues. And I think that's a very good way. And I also, yeah, like Georgia said, making exercises, even what we have for the government, all the civil servants, when they start working for the government, they actually have to go through a training, more like a theoretical training about cyber awareness. And I know actually that afterwards, some of them will get an email, like an exercise email. And if they click the link, they will have a message, you lost now, you are infected or something, just to raise awareness as well. So after the training, they get the email. And I think that's quite fun for those who send the email, but maybe less for those who get the email and clicks the link. But at least it raises awareness, and it's good to have it on a fun part so that people really enjoy doing it as well. But other than that, yeah, it's really important that everyone is doing it, and awareness raising, awareness training from time to time.
Thank you very much, Sheila. Soren, perhaps you would like to share a few thoughts as well?
Sure. Actually, it ties into what I said a little bit before about the near misses, because what really works for us, or I have seen working, is say we had somebody who actually got they got a phone call after having a phishing SMS, trying to get them to click on the link they have been sent, because they are just very, well, they are cocky, those cyber criminals, right? And then we did an interview with the person afterwards, and she spoke about the incident and what she did and why she didn't click on it, and what made her think about this. And that we pushed into well, there was on our intranet, there was on our operator's intranet. So tying it into near misses, I would say that would be the next step on how to actually get people to, you can see a person, you have a picture of the person, and see what went on there. That would be the next level. That works.
Frank, perhaps you would also like to say a few words about this?
Yeah, sure. So Soren kind of took the words out of my mind, out of my mouth, but that's all right. Yeah, first and foremost, I agree with the idea of gamification to show the importance of it. Second, I agree with what Soren said, to not punish people that did fall for a phishing trick, but kind of, show them how much phishing was stopped or didn't, or if it did go through, but users didn't fall for it. Show them that. The third thing I want to add, just thinking out loud a little bit, is make it about something they understand. I mean, if you're looking at a hospital and we're talking about malware or ransomware, which are essentially viruses, try to build your campaign around stuff that the doctors see what they do daily. I mean, it's not that different, but it's just in the cyber domain instead of in the physical domain. So try and play with those things to make them understand more easily what we're talking about.
Thank you very much, Frank. I do not see any further questions from the audience, and we are nearing the end of our session anyway. So I would like to ask all four of you to make some short closing statements on the topic of incident response, perhaps recapping some of the main themes that we discussed today, such as collaboration, information sharing, user awareness, and so on, and the potential role of national authorities and the European Commission in improving both the way that communities share information in the EU, but also in developing the relevant policy framework. So I would like to start with the representative of the of the Danish Health Data Authority and our co-organizers of this year's conference, Søren.
Well, thank you. Well, first of all, thank you for this opportunity. And I have a saying which I've boldly stolen from from Portugal. Sharing is caring. It's the way we actually could move this forward. Is to, I know it's we have said this for a long time, but it is really the route to take. Go into it with open eyes. Build the trust in your communities. It's much easier to do it when you have something to actually focus on. For say a healthcare. Okay, everybody in the healthcare sector has something to share, or that's easier to build the trust inside those little smaller communities instead of saying we have to do it on a global scale. Just it gets too large. You can't really have the people-to-people connection needed to do the trust. So that is the next step. You already summed up quite nicely some of the issues, but sharing is caring.
Thank you very much, Søren. Sheila, any final thoughts?
Yeah, I agree with Søren. So I think information sharing is really something we have to focus on in getting this more vibrant. But also awareness raising, but it was said before, awareness raising, trainings, exercises. You can't just prepare when facing as realistic scenarios as possible, and really don't hesitate in exercising, actually, even if it's a burden and it takes time and costs also human resources. But that's really something one should focus in the future in the healthcare sector, but also in other sectors as well.
Thank you very much, Sheila. Frank, any final thoughts?
Yeah, I can only agree with Søren and Sheila. Share and collaborate. I guess that's been the main topic of this as well. And don't be afraid to share either, and ask to collaborate, even if you work at a small healthcare provider and you have no idea where to start. Start small. I mean, but at least start, and you'll grow into it anyway. But it is important to do it together and not have everyone doing the same thing alone.
And last but not least, Georgios?
I will differentiate from the other speakers. I will just say, as coming from the institutions, that we know the problems. We are very well by ourselves, but we will be better together. So I would say that the member states, and specifically the competent authorities, should be more engaged to the Commission efforts, because it's the only way to move forward. More engagement for the member states, and the Commission has to provide the necessary means to achieve security. that will actually make safer this place. Thank you very much for this very interesting talk.
Thank you very much. I would like to thank you all for taking the time to contribute to this very interesting discussion. I have to say that from our side, the EU Agency for Cybersecurity will continue to do its part in trying to bring communities together and facilitate information sharing, because clearly this is a key topic in both building up the resilience of the healthcare sector, but also in responding to cybersecurity incidents. Now, obviously, these have been some extraordinary months that we've all experienced. The healthcare sector, which is, of course, the main subject of this eHealth Security Conference, has been impacted more than most for a variety of reasons. The healthcare sector has been at the forefront of combating the pandemic, and it has also been the victim of an increasing number of cybersecurity attacks. It's everyone's responsibility to support the healthcare providers in ensuring that critical healthcare services remain unaffected, especially during these times of the pandemic. Hopefully, this year's eHealth Security Conference, which is the sixth conference organized by ENISA, this year organized in collaboration with the Danish Health Data Authority, hopefully this conference contributed even a bit in the discussions in this direction. We sincerely hope that next year we will be in a position to have our next eHealth Security Conference actually taking place physically instead of this year, which was a series of virtual sessions. We would like to thank everyone who participated in these virtual sessions, as well as all of you who joined us through the YouTube broadcast. And we hope to see you next year under much improved circumstances. Thank you very much. Enjoy the rest of your day.